Hi, Mercedes. Welcome in.
Thanks.
How are you today?
Good.
Good. So my name is Rachel, and I'm a graduate student clinician at the UNR Speech and Hearing Clinic. And I know that you're coming in today because you have some concerns about your fatigue, right? Can you explain that a little bit more?
Yeah. So recently I've been doing quite a few presentations in my classes, and some of my classmates and teachers have noticed that sometimes I slur my speech a little bit, or it's a little bit harder to understand than normal. So I thought I'd just come in, make sure everything's okay. Hasn't been anything that's ever happened to me before,
Okay.
so it's a little new, a little scary, but
Right, understandably. Well, what we're going to do today is take you through a motor speech evaluation just to check to make sure everything is working as it should, so we can rule out any potential issues.
okay.
All right, so on your case history form, you included that you've got asthma and you take medication for the asthma, right? Or is it as needed?
Yeah, I have a rescue inhaler as needed.
Okay, all right, that is good to know. And you're also on a muscle relaxant. Can you tell me a little bit more about that?
Yeah, so I take occasionally meloxicam, and I take it as needed. I used to take it regularly. I had a prior injury. I was go karting, and a kid slammed in the back of my cart while I was stopped. So I had a bit of a whiplash kind of moment.
Right.
So one of my cervical vertebrae is a little bit more forward than the other one, so I take it for pain.
All right. Well, I'm sorry about that injury.
Yeah, no
but
worries.
all of this is beneficial to our motor speech evaluation. So thank you for providing that. So for your occupation and daily schedule, you said you're a full-time graduate student.
Yes,
Are you doing anything else?
I'm a full-time graduate student, which takes up most of my time during the week, and then I also tutor.
And how
outside
often do you tutor?
It's usually about 2 or 3 times a week, an
Okay.
hour a day, and then I usually have 2 classes every day, and then clinic intermittently.
Okay. And do you find that your muscular effort is more or less in certain conditions, or in certain when you're tutoring versus when you're in class? Or
Yeah.
is it
If I'm talking with friends, everything seems to be okay.
Okay.
If I'm speaking more in a like professional type setting, whether it's a presentation or just I'm overexerting my explanation, sometimes that's fine where I kind of get stuck or I can't get it out or it sounds a little more slurred.
okay?
And then definitely when tutoring, the mom of the kid I tutor is very intense, we'll put it that way.
Okay.
So I definitely am a bit more stressed and feel very tense. So
So more
sometimes it
stress,
gets
unfamiliar situation.
Yeah.
Okay. More intense. Have you ever had? Do you know of any family history of any motor speech related difficulties?
not that I know of.
Okay.
Not motor speech, no.
Okay. And is there any family history of any just general speech or language difficulties?
My brother was diagnosed with high functioning autism and dysgraphia in elementary school,
Okay.
and then my cousin has Tourette's.
Mhm. And when was the last time you had your hearing screened?
I don't really know the official time I had it screened recently.
Do you know, has it been like a year? Has it been since elementary school?
Probably been like 2 years.
Okay. This is all good information to know. If at the end of this evaluation I feel like we need to go back and look at your hearing, we can always cross that bridge when we get there. But
I haven't had any issues though, and there's no like family history of other than like old age, but
okay, but no hearing issues in class.
nothing genetic wise. My a lot of family members are in the Air Force, so occupationally related, but
okay,
that's not
that's
my case.
loud engines, right? All right. So now I want to know a little bit more about the onset of your problem. So I know that you first started. Did you first start to notice these after your go-karting accident, or is it more recent?
It's actually more recent. So my go-karting accident was 2016, so it was a while ago. In terms of just, I guess it would be uncoordinated maybe. Sometimes it's not as precise as what I'm saying.
Okay.
That's been more recent, probably within the last couple weeks, actually. It doesn't seem to be getting worse in terms of like getting any more worse. It's more like there's episodes of it.
Okay.
I will say it's usually following times I've been staying up really late.
Okay, and how late would you say you normally stay up?
Anywhere from 2 to 4 a.m.
Wow, that's very late. Okay, so you notice that these problems will go away, but then they'll come back after these long nights?
Yes.
Okay.
Yes.
And did you first notice this problem, or did someone else notice this problem?
I think I first noticed it because I would try to say something and then I'd like not say what I was trying to say because it came out weird.
Okay.
So then I'd have to re-say it.
Okay, that's good to know. And have you noticed any other problems coming up other than the slurred speech or incoordination? Have you had any other symptoms that you think might be related to your concerns?
Nothing super crazy. I know sometimes it takes me a minute to like swallow my food, like I have to chew a little bit more, but that's not anything
Okay.
too crazy.
And have you noticed, does the speech problem, has it gotten worse as time has gone on, or do you notice that the problems are just consistent as they emerge?
It's more like there's episodes of it.
Okay,
It's
but
not
it doesn't get worse each episode?
Right, yeah.
And your speech returns to normal quality after these episodes, oh, excuse me. And are you taking any medications that might affect your speech?
Not that I know of.
Okay. Thank you for that information. So you're here today primarily for these episodes. You want to know more about them, correct?
Mm-hmm.
All right. Have you had, you mentioned that you have had difficulty with chewing and swallowing. Do you notice that all the time or just during these episodes?
I wouldn't say it's all the time or just, it's kind of, it just depends on what I'm eating.
Okay. Do you find it's more difficult to eat more solid foods, more mushy foods? What do you have more difficulty with?
Any foods that are, I don't know, like thin foods, so like potato chips or like graham crackers, or it's like kind of like thinner things that like builds up, so you have to like kind of get it out
Right.
from your teeth or like those types of areas.
And do you have any difficulty with saliva production? Is it difficult to gather enough saliva to help the food go down?
No, I haven't had any difficulty with that. I tend to overproduce.
Okay.
I've always been that way, so that hasn't really been a
But not concerning?
no, not that I know of. I mean, you tell me.
Right. So that is the goal by the end of this survey. Do you find it difficult to move food around in your mouth to prepare to swallow?
No, sometimes I do find things get stuck like more in the back, like towards my like molars.
Okay.
So then I'll usually have to go brush my teeth
Okay.
instead to get it out.
I'm sure that is frustrating. Do you find, does food ever get stuck in other places like the roof of your mouth or in your cheeks?
No.
Okay. I know it's a lot of questions, so thank you for bearing with me. Do you have trouble swallowing other things like liquids?
Not normally.
Okay.
Maybe if I'm like laying down, but it's probably not the best.
Right. I know my mom always used to get on me if I was drinking water, laying down on the couch. She'd say, sit up. Do you have trouble getting a swallow started in the first place?
What do you mean by that?
So do you have trouble as food is going back preparing to gulp the food down, or does that not seem to be problematic?
No, that doesn't seem to be
Okay.
anything crazy.
And do you ever find that food or liquid goes up your nose instead of down your throat when you swallow?
Only when I'm laughing.
Okay. And have you ever had food or liquid go down your throat before you're ready to swallow and then you end up choking on your food or liquid?
Yeah, but it's usually when I'm trying to talk while I'm eating.
Right, multitasking. And do you gag or choke regularly when you're swallowing?
No.
Okay. Do you cough after you complete your swallow?
No, not normally.
Right. And have you had to modify your diet at all because of these difficulties?
I mean, I maybe don't eat them as like certain foods as often, but like I still can eat them. So.
But do you find that you avoid foods on purpose because you know you have that difficulty?
I mean, if I want to eat it, I'll eat it.
Right, good. Have you noticed any changes as far as your emotion goes because of these difficulties? Do you laugh more easily lately or less easily? Do you cry a lot? All these emotions are normal, but it could potentially be impacting.
Yeah, no, nothing like that. I mean, if I'm in like mid-conversation with a bunch of people and I'm trying to explain something and I have to repeat it, it's frustrating, but
Okay.
nothing like super severe, uncontrollable or anything like that.
Okay. And have you had any other difficulty as far as moving your jaw or parts of your face, tongue, or neck as you're speaking, or just in normal everyday activities? Do you find difficulty with mobility?
No, I do have TMJ though, so times when I'm really stressed or anxious, it does get more rigid.
Okay.
So that can impact it, but not normally.
Okay. So now I want to get a little bit more about your perception about your symptoms. So what was your speech like when the problem began? Have you noticed changes since then?
I mean, the biggest thing that I can think of that I remember is that it just feels like my tongue is like tired. Like, I don't know, that's the biggest thing that I can remember. It feels like my tongue's tired, or that like maybe it's like bigger in a way, like it's kind of in the way sometimes. Like I can't get it to do it.
Yes.
I want it to do sometimes, so I have to really like pause and then like re-say what I'm gonna say.
Okay, to have better control of your tongue.
Mm-hmm.
Okay. Have you noticed any changes in the appearance of your face?
No.
Okay, and you have sensation throughout? Okay. Can you describe your current speech difficulty? So I know you mentioned that it's harder to move your tongue. How do you feel like your voice sounds? Does it sound like it normally does? Does it sound a little bit more slurred? Is it faster or slower?
I mean, I normally talk really fast, which I'm sure has a lot to do with it.
Mm-hmm.
My voice sounds fine. It's really just, I think, when I've had an overall sense of tired or feeling frustrated or anxious or whatever, even if I'm not consciously aware of it, that's when it happens the most.
Okay.
And it's mainly just sounds.
And does it impact your loudness at all?
No, I'm still pretty loud. It's just not clear.
Right.
It's usually like on a specific words.
Okay. Are there, like, is it just random specific words throughout? Or is it
it's usually maybe like more at the beginning of when I'm starting a sentence or a phrase or something of that nature.
Okay,
like when I'm getting ready to start talking, I'll get like, have to stop and then re-say it.
This is good to know. Okay. Now I'm going to ask you a couple questions, and basically I'm going to want you to rate these for me. So, and anytime throughout these next couple questions, if you have questions about what the numbers stand or what the rankings are, just let me know.
Mm-hmm.
0 will mean never, 1 means seldom, 2 means sometimes, and 3 means often, 4 means always. Mm-hmm. So, for example, the first question, my speech is difficult for strangers to understand.
Seldom.
Seldom. My speech is slow.
Seldom.
My speech is sometimes too loud or too soft.
Seldom.
My speech sounds unnatural.
Never.
My speech problem is so severe that it is difficult for my family to understand.
Never.
I have difficulty speaking when I am in a hurry.
Sometimes.
Okay. My speech is worse in the evening.
Sometimes.
I use a great deal of effort to speak.
Seldom.
My speech has a nasal quality.
Never.
I run out of air when I talk.
Sometimes.
Me too. These next things that I'm going to have you rank are going to be, do you have difficulty speaking in X situation? So, you are attempting to convey important information over the telephone or an emergency.
Seldom.
Okay. You are talking to a family member while you are watching TV or listening to the radio.
Sometimes.
You are asking for information on a group or class project. Or or just in class in general?
Seldom. Sometimes. Sometimes.
Okay. You are at dinner and have a conversation with several people.
Sometimes.
You are speaking with someone who is obviously in a hurry.
I'm not in a hurry. They're in a hurry.
Yes, if you feel like they're in a hurry.
Seldom.
You are talking to someone who is in another room. So if you're like shouting to them from another room.
Seldom.
Okay. You are upset and trying to get the point across.
Sometimes.
You are trying to resolve a conflict with someone.
Sometimes.
You are making a difficult request of someone.
Sometimes.
You are explaining to a friend that something exciting has happened.
Sometimes.
Okay. Now, okay, these are about compensatory strategies. So when you notice that you're having difficulty, are these changes that you make on a scale of the same scale? So 0 meaning never, 4 meaning always. I don't change topics without telling my listener. Do you change topics without telling your listener?
Like that I'm changing the topic? No, I usually just change the topic while I'm talking.
Okay, so, all right. I make sure that people face me when I'm speaking.
Sometimes.
I ask people to repeat what I have said to them.
Never.
Okay. I get people's attention before trying to speak to them.
Sometimes.
Even when the conversation regards me, I prefer to listen rather than actively participate.
No. I
Okay.
still usually talk the most.
Me too, I'm a big talker. In difficult speaking situations, I try to position myself so that I can be seen while I am talking.
Sometimes.
Okay. If someone has misunderstood me, I use different wording when I repeat the message.
Often.
Okay. If people are not watching me as I speak, I move so that the people can see me.
Sometimes.
I avoid trying to talk to someone at a distance or if they are in the next room.
Can you repeat that again?
I avoid trying to talk to someone at a distance or if they are in the next room. So
No.
Okay.
Probably should, but no.
if someone seems irritated when they cannot understand me, I give up.
No.
I keep talking too. All right, we're almost at the end of all these rankings. I know there have been a lot for you, okay? All right, so these are your perceived reactions of others, okay? So how do you think other people are reacting to your speech? Because of my speech problem, people treat me as if I am not very bright.
Never.
Others get irritated with my speech.
Seldom.
Others ignore me if they do not understand what I am saying.
Never.
Others treat me like a child when it comes to communication.
Never.
People tend to get impatient because I speak slowly.
Never.
People fill in words before I have a chance to complete my thought.
Seldom.
People leave me out of conversation.
No.
People speak louder when talking to me because they think I have a hearing problem. Others have taken over my responsibilities because of my speech problem.
No.
When I talk, people pretend to understand me.
No.
All right. Thank you for going through those with me. So now we're going to move on to some more fun activities, I like to call them. And we're basically going to assess your oral structures just to make sure that everything is functioning as it should, okay?
Okay. Is it alright if I go take a drink of water real quick?
Yes. Okay, so now that we've taken a little bit of a water break, now I'm going to assess your oral structures to make sure everything is functioning as it should, okay?
Mhm.
So first I'm going to have you put on this face shield, and you're going to slide it over your hair and over your head, and then you're going to take your face mask off. Yes, I want the part that touches your mouth to stay face up so that...
There we go. Like that.
Yes, exactly. Okay, now I'm going to have you do a couple of exercises for me. Can you first cough?
Can you click your tongue like this? Can you blow like you're blowing a dandelion? Can you blow any harder? Can you bite your lower lip for me? Can you puff out your cheeks like you've got a lot of air and you're puffing? Can you push a little more air in, or is that it? That's it. Good. Can you smack your lips like you just had a really yummy meal? And can you stick out your tongue? Can you stick it out any further? Awesome. And can you lick your lips for me? All the way around. Yeah. So now that I've had you do that, I'm going to quickly put on some hand sanitizer, just so that everything is as clean as possible. And then I'm going to put on some gloves because I'm going to be touching your face just a little bit. All right. So the next thing that I'm going to have you do is I'm going to have you smile for me really big, and now frown, smile, and now can you pucker your lips like you're about to kiss your puppy? And now can you go from a pucker to a smile? And now pucker, smile. All right, so now I am going to have you blow up air in your cheeks just like I had you do before, and I'm going to try to push against the air, but I want you to try to keep the air in your cheeks, okay? Awesome. And now I'm gonna have you bite down as hard as you can, and I'm going to have you open and close. Open and close. Now I'm going to try to open up your mouth, but I want you to keep trying to bite down and resist, okay? Awesome. And now can you open up your mouth? And you're gonna try to keep it open as I try to close it, okay? All right, thank you. And now, can you make a really shocked face? And like now, can you make a face like you just had something really, really sour? Can you shrug your shoulders for me? Can you shake your head left and right? Awesome. Now can you open up your mouth and can you move your jaw left to right? It's a little hard, isn't it?
It just pops. So.
Oh, right, TMJ. Right. Okay, so now I'm going to have you try to push your hand against my hand, or your jaw against my hand, and I'm going to do the other side. Or is that a little bit harder for you?
It hurts.
Oh no, I'm so sorry. Okay. Everything looks good there. Now I'm going to look in your mouth, okay? So I'm going to have you say ah really big. Now can you stick out your tongue for me and say it even louder? Now can you go ah. Thank you. Now I'm going to have you, as if you had like peanut butter on the roof of your mouth, I'm going to have you scrape it off the roof of your mouth with your tongue, okay? All right, looks good. Now I'm going to have you, just like I had you cough before, can you cough really strongly again? All right, does that hurt at all?
No.
Okay, feels normal. Now can you say uh-oh?
Uh-oh.
All right. Now can you take a really big deep breath in for me? Like a... Now can you take, like you just saw something really scary and you're gasping. Okay. Okay. Just trying to take as many notes as I can, okay? Now I'm going to have you glide for me, okay? And then I'm gonna do a couple tongue exercises. I'm just trying to give you a little break from that. So now can you go, Do you feel like you can get any louder and stronger, or does that?
Yeah.
All right, now can we do the opposite, and you're gonna go from high to low. Awesome. Awesome. Now, the last thing I'm gonna do is use this tongue depressor to look at your tongue, okay? And I am going, it's strawberry flavored, so it should taste pretty good. And I'm gonna have you push against your tongue, push against the tongue depressor with your tongue so I can see how your tongue is functioning. Okay? So can you stick out your tongue just like you did before? And can you push against it? Can you push against the stick? Now I'm gonna move it to the side. Can you push against it here? And push it to the other side. Can you do it there? Okay, now can you stick your tongue out again? And can you push up against the stick? And down against the stick? Is that a little bit more difficult? Oh, okay. Now I'm going to have you say ah again one more time. Okay, now I'm going to assess your gag reflex. So I'm just gonna have you cough whenever you feel like it's too hard for you, okay? Wow. Woo. Gag reflex? Yes. All right. Now I'm going to have you do one more thing for me with your tongue, and you're going to push your tongue up against your cheek, up against my hand, and just push, okay? So this side. Okay, now this side. All right, so now you are done with my hands on your face. So thank you for bearing with me.
Okay.
All right, so the next thing that I'm going to be doing with you, I'm going to be assessing your speech in different ways.
Okay,
So I'm going to have you say ah. You're going to hold ah at a comfortable volume, and you're just going to take a nice deep breath, and you're going to hold ah for as long as you can.
Okay.
And whenever you're ready, I'll press the timer. Nice deep breath, and go. Okay, I know that is a lot of breath work, but I'm going to have you do it a couple more times for me, okay? Ready? All right. I'm going to have you do it one more time for me, okay? Ready? Nice deep breath in and go. All right, thank you for that. Now I'm going to have you hold a couple more sounds for me. So you're going to make the sound s for as long as feels comfortable after taking a nice comfortable breath, okay?
Okay.
Tell me when you're ready. Nice deep breath in and go. All right. And I'm going to have you do that again whenever you're ready. Okay, and one last time. Nice deep breath in and go. All right. Now I'm going to have you do that same thing, but instead of the S sound, you're going to make a Z sound. So, zzz, okay? And you're just going to hold it until you run out of air. Ready? And go. All right. I'm gonna have you do that 2 more times, all right? Do you feel like you've got enough air? All right, ready, set, go. have you do that one more time for me, okay? Ready? And go. All right. Nice work. Are you feeling okay? Do you need water? Are you feeling okay? All right. So the next thing I'm going to do is assess your alternating motion rate. We're just looking to see how you produce your sounds, okay? So what I'm gonna have you do first is take a nice deep breath, and you're gonna say pa 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 as long and as fast as you can until I tell you to stop, okay?
Okay.
So whenever you're ready, take a nice deep breath in and just say pa as many times as you can until I tell you to stop. Ready? And go.
Pa 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 pa.
All right. I'm gonna have you do that 2 more times for me too, okay? And deep breath in. And go.
Pa 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 pa.
All right. And one last time, okay? Ready, set, go.
Pa 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 pa.
All right. Nice work. Now I'm going to have you do that same thing. We're going to say the same sound as long and as fast as you can, but instead of the pa, we're going to do ta, okay? All right. Ready? Nice deep breath in and go.
Ta 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 ta.
All right. We're going to do that again. Do you feel ready?
Mhm.
All right. Nice deep breath in and go.
Ta 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 ta.
Okay. And one more time. Ready? Go.
Ta 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 ta.
All right. Thank you. I know it's getting a little bit repetitive, so thank you for bearing with me.
All good.
I'm going to have you do that same thing one last time, but with the ka sound instead. So you're going to hold the kas for as long and as fast as you can until I tell you to stop. Or not hold it, but you're going to say ka 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 until I tell you to stop, okay?
Mhm.
Ready? And go.
Ka 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 ka.
Okay. We're going to do that again. Are you ready? And go.
Ka 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 ka.
Okay. And one last time for me. Ready? And go.
Ka 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 ka.
All right. Now, we are going to take those 3 sounds, the pa, the ta, and the ka, and we're going to put them together. So it's going to sound like this. Pa ta ka. Do you want to try?
Pataka.
So you're going to say that as many times as you can until I tell you to stop. Just like we did with the pa, the ta, and the ka, but instead you're going to put them together. All right? Whenever you're ready, and go.
Pataka. 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 Pataka.
Okay. And now we're going to do it another time. Ready, set, go.
Pataka. 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 Pataka.
All right. And one last time we're going to do that. You're doing a great job working with me. Ready, set, go.
Pataka. 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 Pataka.
All right. Thank you so much for working so hard with me. I know it gets repetitive and exhausting. Now, one of the last things that I'm going to have you do, I've got 2 more things for you. So the next thing I'm going to have you do is count rapidly for me. So you're going to count 1, 2, 3, 4, up until 100, okay? All right? Ready? And whenever you're ready, I'll time you too.
Okay.
Ready, set,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100.
Awesome work. You did a great job. I know, like, it's so easy to run out of air when you're counting.
Okay.
So the last thing I'm going to have you do is read a fun little passage called the grandfather passage. And I'm going to use this to assess your fundamental frequency, which is the pitch with which you speak.
Okay.
So what I'm going to do is use this app, this really fun app, that's just going to assess just that. It's going to tell me what your fundamental frequency is, and then depending on what it is, we can do different things with it in a therapy setting. So whenever you're ready to start reading, just let me know, and I will start the recording. Ready?
You wish
There you go.
You wish to know all about my grandfather. Well, he is nearly 93 years old, yet he still thinks as swiftly as ever. He dresses himself in an old black frock coat. Usually several buttons are missing. A long beard clings to his chin, giving those who observe him a pronounced feeling of the utmost respect. When he speaks, his voice is just a bit cracked and quivers a bit. Twice each day he plays skillfully with zest upon a small organ. Except in the winter, when the snow or ice prevents, he slowly takes a short walk in the open air each day. We have often urged him to walk more and smoke less, but he always answers banana oil. Grandfather likes to be modern in his language.
Thank you so much. Okay, so now that I've collected all this data from you, what I'm going to do is go through all of it and analyze it and compile a report for you so that then I will be able to discuss our next steps moving forward.
Okay, sounds great.
Thank you so much for coming in today.
Thank you.
Bye.
Okay, so prior to even seeing Mercedes, I reviewed her case history, and based off of her initial complaints, the reason why she was coming in today, she was coming in because her teachers and classmates were noticing that her speech was slurred. So this is something that could indicate a potential motor speech disorder. However, she didn't notice any other symptoms that could potentially indicate a motor speech disorder. But in order to completely rule one out, I would need to do a complete assessment, which is what I did in this video that I just showed you. Now, before even coming in, I need to make a hypothesis about what I'm going to see. So I can either choose from a motor speech disorder, an articulation disorder, or a voice disorder. And based on the findings that she told me, in addition to the concerns of slurred speech, she was telling me that she was giving a lot of presentations in school and that she's been in grad school this past semester. So I'm hypothesizing that there's potential vocal fatigue going on. Upon meeting with her, there were no indicators that there was a motor speech disorder. So my initial hypothesis is that based off of the information that she gave me coming in, that she's going to have a voice disorder of some type. She did tell me that a couple years ago she did have a go-karting accident in which someone hit her and she had whiplash, and now her C5 vertebra is protruding, but it did not cause any difficulties or speech-related impairments, or she didn't notice any difficulties that could possibly be related. It's good to know about, but I don't think that it's a contributing factor to why she is here today. So after going through her case history, next I went in and talked to Mercedes about different measures, such as her perception of why she was coming in today, the onset, different things like that. Next, I went in and talked with her about quality of life measures. And I added up that she got a 40 on the quality of life measures, and this indicates that her perceived motor speech difficulties are having a minimal to a moderate impact on her quality of life. So it's a good sign in that they are not causing a severe impact. 40 is a little bit high, but it's definitely on the low end. So I'm not too concerned after going through those motor speech quality of life measures. So when I was doing Mercedes' oral peripheral exam, I noticed that she was not able to stick her tongue out very far. This could be a muscular difficulty. I'm going to need further assessment in order to determine if that is anything that could be causing too much difficulty. And I will discuss this a little bit further with my findings, but I didn't notice it really having an impact on her ability to take part in any of the other exercises throughout the assessment. When I assessed Mercedes' jaw movement, she did mention to me that she has TMJ, so I noticed clicking. But again, as far as cranial nerves, oral peripheral exam, I did not notice anything that was alarming or that stood out to me that could be an indicator of a motor speech disorder. When I asked Mercedes to take a big deep breath in, like this, she was not able to really get a dramatic deep breath in. It was less forceful. And that was a big common thing that I was seeing throughout her assessment, was that her breath support did not seem to be where a normal person's would be. This then made me think, okay, maybe I need to work on breath support with her in a potential therapy setting in the future. Aside from this, I didn't see anything that stuck out to me as abnormal as far as oral structures, cranial nerve function. Everything looked like it was functioning as it should be. If anything, as I was going through this, I was going back to fatigue and breath support the whole way through. The next thing that I did with Mercedes was look at her maximum phonation time. And her maximum phonation time, on average, after going through the 3 trials, was 11 seconds. When I asked her to perform the maximum phonation time, there was no latency time or period between the time when I asked her to produce an ah and the time when she was able to produce it. So that is a good sign. Her ahs were pretty stable and consistent throughout, so I was not alarmed by that. The average maximum phonation time for a female adult her age is around 22 seconds, and the minimum is 15 seconds. Now, since hers was 11, this is slightly below, but again, this could be a potential indicator with her lack of good breath support to support her phonations. Next, I went through Mercedes' S to Z ratio, and she was able to hold her S sound for around 11 seconds on average and her Z sound for around 16. So this made her S to Z ratio 11 to 16, or around 0.69 to 1. Now, a normal S to Z ratio is a 1-to-1 ratio. And upon doing further research, the only time an S to Z ratio really becomes alarming is when there's a really striking difference where the S is maybe greater than 1 in comparison to the Z. But I didn't find anything that was specific that could indicate that her ratio was potentially detrimental. I think that, again, this goes back to her lack of breath support, possible vocal fatigue. Her S's were pretty inaudible and weak. In the video, you probably saw that. It was hard to pick up on it, even in person. And then her Z's were a little bit louder, as they should be, as they're voiced. I didn't notice any inconsistencies throughout each of the 3 trials of her S's and then Z's. Everything remained pretty consistent throughout each of the trials, which is a good thing. So next, I assessed Mercedes' diaticokinetic rate abilities, and when I first asked Mercedes to produce as many puzz as she could in 5 seconds, she was able to produce 15 puzz in 5 seconds. This translates down to about 5 puzz per second, and norms indicate that on average, people Mercedes' age are able to produce 6.3 puzz in 1 second. She falls right along where norms suggest she should. Next, I assess Mercedes' ability to produce as many tuzz as she could in 5 seconds. And she was able to produce 19 tuzz in 5 seconds, which translates to about 6 per second. And norms for
people her age for TUS is about 6.2 TUS per second. So again, this places Mercedes right at the average number of TUS per second, which places her right on track. Finally, I asked Mercedes to produce as many cuz as she could in 5 seconds. She was able to produce 17 cuz in 5 seconds, which then translates to about 5.5 cuz in 1 second. And the average or the norm amount of cuz that a person her age should be able to produce is 5.8, which again puts her right on track. So finally, when I had Mercedes place the pa and the ta and the ka together to produce pataka, she was able to produce 7 productions in the 5 seconds that were allotted to her. And the average amount of productions for a person her age was 5. So again, this is another indicator that she is able to produce alternating and sequential motion rates that are appropriate for a person her age, leaving no reason for concern regarding these abilities. One important thing that I did want to bring up before moving on with my observations was that when I was explaining to Mercedes how to put the pa, ta, and ka together for sequential motion rates, I didn't model how it should sound like pataka, pataka, pataka. I just modeled how to put the sounds together. So if I could go back and change one thing, it would be that I would model how I wanted her to do it. But aside from that, I really do not have any concerns regarding either Mercedes alternating or sequential motion rates. Now, when I did the stress testing, which was the next step of this phase, she was able to count from 1 to 100 with relative ease. She was pretty quiet from about 1 to 70, and then her volume picked up, and this is right when she took in a big deep breath of air, and I think it was a little bit of a reminder for her to use her expiratory effort. This change in volume was a little bit interesting to me, and I found it to be noteworthy. I think this again points back to her respiratory control, but I am interested in discussing her respiratory effort in a therapy setting as well. Finally, I wanted to assess her speech in a reading sample, so I used the grandfather passage, and I found that she was 100% intelligible. She was pretty monotone in mono loudness. There was not much variability throughout the entire reading passage, but she was completely intelligible. She was a little bit soft. She did not speak projecting her voice, or if there was an exclamation point in the passage, she did not mark that with her voice, but she spoke very clearly, very intelligibly. So based on all of these findings, I don't think that there's any articulatory difficulty or motor speech related difficulties. Her respiratory difficulties and quietness could be related to a voice disorder. And upon assessing her oral mechanism, I did not notice anything that could indicate a potential organic or neurogenic pathology. I am using my clinical judgment to assume that Mercedes potentially has a functional voice disorder that is contributing to her inability to use her voice to its fullest extent. So I would recommend some voice therapy, and I would focus on voice facilitation techniques. I would also stress the importance of vocal rest, vocal hygiene, taking care of herself during the stressful time that is grad school. But I am not concerned that she has anything that is potentially harmful to her. I just want to help her learn how to use different strategies to help her use her respiration to articulate as loudly and effortlessly as possible. I also think that it's important to remember that upon talking with colleagues, I need to decide whether or not further instrumentation is necessary. A big part of the motor speech evaluation is perceptually based, and nothing was giving me the indication that there is anything wrong. This is why I went with the hypothesis, or I changed my hypothesis to believe that Mercedes has a functional voice disorder, and that if we were to work on vocal techniques and hygiene strategies, her fatigue and her respiration and her respiratory support overall will improve her speaking overall as well.